Hi, everyone. I am joined by Sharon Edwards, Homeopath and Medical Thermographer of the Thermography Medical Clinic. We've been working together over the last few months and hosting some thermography clinics here at Tri Health, and it's a pleasure to have Sharon joining us today. How are you, Sharon?
I'm great. Thank you so much for inviting me to talk on this exciting topic.
Yeah, it's amazing that I always wanted to introduce thermography and work with someone that has your expertise, and it just kind of worked out over time. And with delay of the COVID lockdown, and now that we've hosted a couple of clinics, it's been really successful, and I've been so pleased with the response that the clients have been offering and their experience and the amazing information that we're getting from these assessments. Why don't you speak a little bit to the utility and the purpose of thermography?
Okay, so I'll just give you a little bit of a history quickly. So I started using thermography in my clinic back in about 2010. I was simply just looking for a better way to get, I guess, like a visual picture of what was actually going on with my patients, because sometimes, taking an actual like intake and doing a questionnaire, people typically leave out information that's important, or they just forget that something may be important to their health history. So I really wanted to find a tool that was going to be useful for an assessment and an evaluation purpose as to what was actually going on with my patients, and then that would give me a better place to start. So I always talk about thermography as being useful as a health assessment tool. It really is about being able to evaluate in a very non-invasive way what's happening with my patient, what's going on, what are their symptoms coming from, and where are the areas of concern in the body that actually require attention. So as I learned over time, that many people can have very similar symptoms, but the cause of those symptoms can be very different for each individual person. So I think that knowing the underlying issue that's contributing to a person's decline in health is really important in terms of a treatment protocol. So thermography is really useful from my perspective as getting an overall visual picture of what's going on with a patient. I also use thermography to monitor whether or not my treatment protocol is working. So is my patient getting better, or are they getting worse? So over time, we can do repeat thermography scans and see what changes are happening to determine whether or not what I'm doing as a practitioner is actually working and making them better.
Right, that's amazing. Um, my first exposure to thermography was patients coming to me seeking an alternative to the mammogram. And
Right.
then breast thermography started to come across my feed and coming across the desk. And I'm starting to see more and more people asking about it and how it relates as a quote unquote alternative or another option for mammograms. And then also how it expanded to like more of a full body assessment and understanding the utility of not just assessing the breast tissue, but like we can learn a lot about the entire body and all the different functions internally through this amazing tool. What's your experience with individuals seeking as maybe a secondary option for a mammogram or an in between, because sometimes they go a couple years without a scan. Can you speak to that?
Yeah, so originally when I started doing thermography, it was breast thermography, and that was kind of what I knew it to be. That's what I understood it to be. But as time went on, I really began to realize that thermography was more than just, a breast assessment or a breast health assessment, as a lot of people try to market it and advertise it. Um, in terms of like thermography being an alternative to a mammogram, we have to remember that thermography is not a diagnostic tool. It is not really, an appropriate screening tool for diagnosing conditions. And I think that that would be true as well for the diagnosis of breast cancer. So a lot of people have, in some ways, been led to believe that thermography is an alternative to mammogram, but it's a completely different test. And it's not really meant to be used for the purpose of diagnosing breast cancer or seeing breast cancer early. What I always think about in terms of women's health, especially related to breast health, is that typically changes that occur within the breast tissue are due to other underlying issues. So whether that be liver stress, hormonal imbalance, toxicity in the body, there's links and connections to dental issues. So again, I always go back to I'm not looking at the breasts to see specifically what's happening in the breast. I'm more curious to know about if I'm seeing a change in the thermal presentation in the breast that's concerning or that indicates inflammation. My question always is, why is that? And how do we address the underlying cause? So we have to remember that thermography is not really a test in which I see it needs to compete with tests like mammography, ultrasound, MRIs, even CT scans. It has its own unique contribution in terms of its ability to detect and, in a sense, see, early signs of inflammation, where that inflammation is and where it's coming from. And then, as I've said before, to use it as more of a monitoring tool. So, for women to think that thermography is an alternative to mammography, it really isn't, because it's a totally different test. And I think we have to use these types of tests, collaboratively.
Yeah, so actually that's a good point, because I wanted to kind of touch upon how you've seen thermography lead to like connections with other practitioners. How do you find that other fields that they've taken to thermography and how they've utilized the usefulness of the information, and how it attributes to their treatments, their assessments, and how it's kind of made it, give them a different spin on things?
Yeah, that's a really good question. So I think that thermography is useful for every type of practitioner. So whether you're a naturopath, a homeopath, a nutritionist, chiropractic, osteopathic, you name it, I think thermography is useful because if I can give an example, I think this might sort of paint the picture. So I am a practitioner and I often have people coming to me complaining about, chronic issues. Maybe chronic pain might be something that they complain about. I think as a practitioner, it's really important that we realize what the underlying cause may be of that individual's pain. So not everybody who has back pain or joint pain, it's the result of a musculoskeletal imbalance. For some people, this chronic joint pain, back pain, whatever kind of pain it is related to more inflammatory conditions in the body. So I think that it's really important that regardless of what type of practitioner we are, that we learn about, our patients' conditions and symptoms, and use thermography to be able to determine what type of treatment plan that they need, or what type of practitioners that they may need to be seeing. So a lot of people need a collaborative approach. They need to see a naturopath or a nutritionist. They need to see a structural therapist. But I think being able to be more specific about the underlying cause of what's happening with our patient, I think it helps us as practitioners to steer them in the right direction. It makes our patients get better faster. And I've learned over time that the happier our patients are, and if they really feel that we've helped them or guided them in the right direction, whether it's through modalities that we use or whether it's recommending them to other practitioners, they become very good referral networks for us. So I think that regardless of what you do in terms of a practitioner, thermography can be useful to show you the areas where that person really, really needs to work on. And for you as a practitioner, I think it helps to kind of set up what your treatment protocol or your treatment plan going forward should actually be.
Right. Because you've seen multiple scans from the same individual, could you speak to an example perhaps where you've seen like a significant improvement, and maybe mention like if there was like Was it a dietary thing? Was there something like a postural? What maybe give us an example of some amazing changes that you saw in some scans over time.
Yeah, so I've done a lot of scans and I do a lot of report writing. So I've seen thousands of scans over time, and I've also seen people come back for repeat scans. And so I think one very interesting case that I think of was this lady who came to our clinic, and her symptoms were related to cardiovascular. So she had a lot of heart palpitations. She complained a lot about like shortness of breath and chest pain. And she had been to a variety of different, healthcare providers looking for answers to what was actually causing these symptoms. So she heard about us from somewhere, came for a thermography scan. So we did the scan, and after evaluating her images, it was very obvious that she had something going on with her upper back. T2, T3, like in that thoracic spine area. She was a dental hygienist, dental assistant, so she obviously spent a lot of time hunched over, poor posture. And so evaluating her scans, there was absolutely nothing in terms of a thermal presentation that indicated cardiovascular or lung related changes. So I thought, makes sense that maybe this part of the spine, that's affected, this beaming focal hotspot, it correlates to the cardiovascular system and the respiratory system. So we actually sent her to see a couple structural therapists. She went to see a massage therapist, and we sent her to a chiropractor to do some adjustments. And then she started participating in more like, physical conditioning and exercise program. And so after, I'd say about 6 months, she came back for her follow-up scan. There was a very significant improvement in the thermal presentation related to that previous finding. And after having these treatments done, she reported that she had no longer been experiencing any of these heart palpitations or cardiovascular related issues. So had we not done the thermal scan, I think that for a lot of patients, because they have symptoms, cardiovascular related or whatever it was for her, you're always looking for something to treat the symptoms as opposed to addressing the underlying cause. And I really think that that is the biggest contribution that thermography has. It's about, the body often says, hello, here I am. This is the area of concern that needs attention. Pay attention to me. And if we can see where the body is prioritizing these areas of concern, then we can obviously address them sooner rather than later.
Yeah, that's an amazing example. I with my patients that have done the scans and we review them, it's always amazing because all of them, they'll always bring up the point. It's like, hey, you know what? I never mentioned this, but I do have a problem in that area. It's either it's always sore or it's cold or when the weather changes, and the scan is picking up something that you highlight in that area. And I'm like, yeah, you know what? It's something is showing up, whether it's like a very deficient dark area or very inflamed. And could you even speak to maybe picking up things before they become a problem? Maybe the antecedents of a bigger issue. What does that look like, or have you experienced with that?
Absolutely. So the other thing that thermography is very useful for, of course, is prevention. And unfortunately, we often see people who already have existing conditions that are looking to reverse that. But thermography is really, really useful for evaluating these very early changes in terms of inflammation in the body that can, of course, then, if left unattended, can develop into chronic conditions. So we often see subtle changes. People come in and they're like, hey, you know what? Like I just want to do this for a checkup. I'm feeling good. I don't really have any issues. But as we know, before symptoms develop, there are things that begin to change in the body, maybe very subtly, and people don't really recognize the change in symptoms or the onset of certain symptoms. So thermography is very useful for identifying like those very early signs. And sometimes we'll see people who are going through a very stressful period of time. They think that they're managing the stress well, but we can see in their body from their thermal presentation that they're not managing the stress well. And there's a lot of inflammation that may indicate that, you know, their cortisol levels are very high, their adrenals are on overdrive, their liver is stressed as a result of it. We also often see very early signs of cardiovascular related findings. So looking at things such as the carotid arteries, we'll also see thermal changes in the presentation of the hands. And this is why I love the full body, because sometimes if you don't do the full body, you miss some of these subtle thermal presentations. So changes in the hands can indicate that somebody has a risk for developing conditions like hypertension or blood sugar related issues. They may not have the symptoms, but we can tell by looking at these patterns and how things are changing, you know, kind of in which direction their health is heading. So I think it's really important that people not just think about thermography as finding out what's wrong with me now, but using thermography to be able to look at what's going to be wrong with me in the future if I don't, you know, be proactive and think about my health in terms of the prevention of disease. So there's so many different applications, and there's so many different things that we evaluate in a study when we see these images. And for each person, you know, their thermal presentation is about what's going on with them. So it's very unique to them and what's happening within their health.
That's cool. Because as you're describing, like, you know, potential for heart disease and seeing changes in the hands, it's reminiscent of like when I was studying Chinese medicine, and very much so. There's a pattern in the tips of the fingers, and different even treatments using needling to help reverse the effects of a stroke or minimize a risk factor during a cardiovascular event. Um, so I see how thermography is actually a little bit of a like a window into some of our therapies and modalities that are we understand conceptually, but we've had some difficulty showing like a visual explanation or correlation, saying, hey, you know what? We're seeing enough people that are having a pattern in their hands that is consistent with individuals with a risk factor for cardiovascular disease, which obviously, you know, is dovetailing with what we understand in terms of the meridian system. As a homeopath, I'm sure you've studied a lot of like character types and pictures, and especially with all the homeopathic remedies and the polycrest, you see a type. Now, does the thermography scans ever remind you, once you know a little bit of the history, that, hey, this is like, oh, this is obviously a pulsatilla person?
Yeah, so that's interesting because I do a lot of follow-up phone calls with people after they've had their scan, and we talk a little bit about the findings and stuff. And I think I've really learned over time that, you know, there are certain thermal presentations, and it's like I see like there's themes, right? There's just the way the patterns present in certain areas of the body. And I think it ties in so many different modalities, homeopathy, also, like you said, Chinese medicine. I see a lot of thermal presentations, you know, in the body where it's too hot here, or it's too cold here, or the person's too cold in general, right?
Mm-hmm.
And it's interesting that, you know, those thermal changes, as I've like followed people and like kind of kept track of personality types or, you know, just characters, we certainly see, you know, in the thermal patterns, these connections, right? People are too cold, they're too hot, people are very stressed, people are very anxious, or people are very subdued. So yeah, like putting all of those thermal patterns and presentations together, and then keeping track of like my patients, and we do other tests in the clinic, and it's like I'm a correlation junkie, right? Just love to connect all of these findings with different aspects of people. So whether it's, you know, organ system dysfunction that we see present in a certain way, or whether it's personality types, Yeah, there's certainly, I think, so much information that these thermography studies actually provide. And I think that over time, like I'm still continuing to learn, and I'm learning just by talking to people, and also learning about like conditions and symptoms and character, how we're seeing these changes occur in the thermal scans. So yeah, there's definitely, you know, so much information that you can see from these thermography studies.
Yeah, I enjoy seeing your reports and seeing how, because we usually have like 4 or 5 different people in one clinic, like a presentation. So everyone sort of has like a little bit of a different scan, and you can kind of see how people are different. And because of most of them are existing patients, it sort of confirms some things that I suspected. It highlights some things that I didn't know, which is, I think,
Hmm.
the most useful, because their intakes, like you said, they give you a lot of information. They don't necessarily write down everything or recognize something as an issue. And then
Yeah.
you're like, hey, do you notice that you have a little bit of a limp? And they're like, no. Do I? And then they start paying attention to it, and it's like, oh yeah. And then you see the scan, it's like, oh wow, something's happening in your lower spine, or in the back of your knee, whatever it may be. And so thermography for me has been such a like, it opens up a whole other realm that otherwise is just totally being missed out on. And it's
Hmm.
it's amazing, like, in between, from describing your symptoms, experiencing something, and not having to wait 6 months or a year for some kind of MRI or some ultrasound to identify, oh yeah, you know what, there's a problem here we should have been addressing. This is giving us real-time information as it's maybe just starting out, because this inflammatory presence is usually one of the first signs of disease. So if we can
Absolutely.
address it initially, we can kind of preempt any kind of progression of a disease state, or a worsening of symptoms.
Hmm.
So yeah, Sharon, thank you so much for your time and your expertise. We are hosting another thermography clinic this week on Thursday at Tri Health, and I think we have a couple slots left. And if anyone's who's watching this before February 4th, by all means, please check out our profile for the link to schedule your thermography. I encourage the full body thermography. It just, as we discussed, it just gives like such a complete picture that otherwise we would be missing if it was just like a half body, or just breast thermography. Even though those are still very relevant, and some people just like they prefer to do maybe thermography on a yearly basis for their breast assessment in between mammograms. So that's always very valid and useful as well. So Sharon, any parting thoughts?
No, just if you are interested again in booking, you can either book, I believe, through your clinic, or you can go online to our website at thermography-medicalclinic.com, and you can see the upcoming clinic date, and you can schedule your appointment there. So yeah, and just consider, like we just talked about, booking a full body scan, because for sure it's the best health assessment that you can invest in.
Okay, thank you so much, Sharon.